Hello everybody, hope you're well. Thank you so much for watching this video. My name is Reza, and in this session I'm going to talk about the gluteal muscles. I will start with the largest muscle in our body, which is the gluteus maximus, and it plays very important role in many of our functional activities such as walking, running, and even lifting. So if you take a look at the muscle system, the gluteus maximus, which is the superficial muscle, it originates from the posterior or rear part of our sacrum. The sacrum is the lower section of our spine. So part of the gluteus maximus originates from the rear part of our sacrum, then on the ilium, and also on the iliac crest. So this is what we can say the origin of the gluteus maximus. Then it will attach to IT band, which stands for iliotibial band, which connects the ilium to tibia bone under our knee. So this is a long fascia, which is mostly part of the stabilizers, and the gluteus maximus will be attached to this part, plus the upper section of the femur bone, which is the upper thigh bone. So this is how the gluteus maximus attached. The functionality of this muscle is very important. As I said, it's going to be involved of many of our functional activities. But major function, if I want to just tell you in case of the joint movement, is the hip extension. So hip extension is one of the major function of the gluteus maximus. That's why when you do exercises like deadlift, even squat or lunges, this muscle is going to be one of the muscles of the target muscles. So hip extension, and also when you have a fixed thighs, means your thighs are not moving, and you're trying to extend your hip, again the gluteus maximus will be involved. The other movement of or function of the gluteus maximus is external hip rotation. So if this is a rotation, so external rotation of the hip is also part of the gluteus maximus functionality. There are like a few more activities or functionality for the gluteus maximus, like hip abduction and adduction, which partially this muscle will be involved. The other muscle of the gluteal area, which is gluteus medius. So the first one was the gluteus maximus, was superficial and was a large muscle. The second one is the gluteus medius, which is underneath of the gluteus maximus. So it's not superficial, it's in the deep layer, and the insertion and the origin of the muscle is on the iliac crest. As you see here, this is the gluteus medius. So iliac crest and also the part of the ilium. So this is the muscles that at the origin of this gluteus medius, and the insertion or the attachment of this muscle is again on top of our femur bone, which is the greater tuberosity. And then the functionality of this muscle is very specific. One of the most important muscle for the hip stabilization is the gluteus medius. So that's why this muscle is very important, because when you have one of your legs off the floor, the balance of the hip mostly is going to be on the gluteus medius. But one of the major functionality of the gluteus medius is hip abduction. So if you remember, this is abductions, means away from your midline. So this is related to shoulder joint. The same movement on the hip joint is going to be hip abduction, which the gluteus medius is one of the major muscle for this functionality. So the third muscle of the gluteal group or gluteal muscles is the gluteus minimus. So this gluteus minimus is the smallest muscle of the buttock groups, and again is the underneath of the gluteus medius. So it's on a deeper layer. The origin of this muscle is on the posterior or back part of the ilium. So if I want to tell you what is ilium, this is ilium on this skeletal system. If you look at it, this is ilium and this is sacrum. So ilium, sacrum. So the gluteus minimus is going to be located or origin from the posterior part of the ilium, and again, same as the gluteus medius, is going to be insert or attached to a top part of the femur bone, which is the big bone on our upper legs. So if you look at here, you can see like the insertion and attachment. Again, the major functionality of this muscle is also hip abduction. Again, hip abduction means your legs going to be away from the midline of your body. Another movement or functionality of the hip muscle of the gluteus medius is hip medial rotation. So if you remember again about the rotation, external or internal, medial and lateral. The medial is when you get close to the midline. So one of the major functionality of gluteus minimus is hip medial rotation. So in terms of the exercises, there are certain movement that you can use for strengthening of these muscles, and mostly there are like exercises that you do for the hip abduction, and like you can use the bands or also cables to specifically target these muscles, but these muscles is going to be involved in most of the exercises that you do for the lower body, and they are going to stabilize the hip joint for you. So there are a couple more important muscles that I want to just mention you the name of them, and the reason they are important is, for example, this is one of the gluteal muscles, which we call the piriformis. Piriformis muscle is the one that our sciatic nerve is going to be underneath of this muscle. So you may heard about the sciatica, which is one of the condition that people may get, and they have problem with the sciatic get challenged. The similar symptoms you may receive when you have the piriformis symptom. So piriformis symptom is one of the conditions that when these muscles get under pressure, your sciatic nerve will be under pressure as well, and it's going to give you not a very comfortable symptoms, and by having those symptoms you need to just do enough treatment on this muscle. So that's why I wanted to mention, and one of the major functionality of the piriformis muscle is again we call hip lateral rotation. So this is lateral, so the same movement on your hip joint. So lateral movement of your hip is one of the muscle is going to be piriformis muscle. There is one more muscle that I would like to mention about it, which is TFL, tensorofasciolate. This is one of the hip abductors. So when you're doing the hip abduction for the gluteus medius and minimus, this muscle also will be part of them. So the reason I just want to mention is because this muscle originates from the ilium, and also ASIS, which is the anterior superior iliac spine, which part of the anterior section of your iliac. So it goes down to the IT band, and as I mentioned, IT band is going to be connection between ilium and tibia, and so it's going to cross the knee joint, and that's why it also has effect on the knee joint stabilization. So if you're doing activities such as running, walking, even lifting, squat, lunges, and then deadlifts, this is going to be also involved. Beside that, you may have seen or you may have felt like uncomfort, tension, or pain around the hip area, and it could be because of the sitting out for hours, for work reason, or driving for hours, or even running. This muscle may become tense, and you may feel uncomfortable. So you have to stretch them properly, treat them properly, and also beside that, you have to make sure they are strong enough. So regarding the gluteal muscle, this is the gluteus maximus, the origin here, part of the sacrum, the posterior or rear part of the sacrum, and also part of the ilium, which is the hip bone underneath, and then it goes to the IT band, this white fascia, as you see here, and also it will be also attached to the femur, which is this bone underneath, which is the very strong bone for the upper thigh. So the origin and the insertion of this gluteus maximus muscle. Then underneath, as you see here, partially, you can see the gluteus medius. This is this muscle, and origin is going to be this one, the ilium part, and then this is the insertion, which is the top part of the femur bone underneath. And then on the deeper layer, you can see the gluteus minimus, which is this one. So gluteus minimus is underneath, and again you can see the origin is in the ilium, which is this bone, and the insertion is the femur bone. As you see here, the femur bone is right there, and this is also the piriformis, which origin is here and also goes to upper part of the femur again. This is the piriformis. The TFL is on this side. Alright, thank you so much again for watching this video, and good luck.